Hi, I'm Dr. James Zurich. I'm the Clinical Director of Tamworth Mental Health Service, and it's my pleasure to welcome you to Banksia, our acute mental health unit. Come on in and meet Maureen, our nurse unit manager. Hi Maureen, thanks for joining me today.
My pleasure.
Maureen, could you tell our JMOs a little bit about Banksia?
Banksia is a 25-bed declared mental health facility. It caters for patients who come both on an involuntary and voluntary basis. 21 of our beds are in what we call our general ward area, and we have 4 beds in our observation area, which equates to our high dependency unit here in Banksia.
Could you tell me a little bit about the kind of reason that a patient might need to go into the high dependency unit?
People come into the high dependency unit for a number of reasons. It's usually when they're in the more acute phase of their mental illness and there may be quite disturbed behaviours in relation to mood, delusions, and it allows a lot closer observation, and sometimes a quieter, more contained area is more beneficial for patients when they're in that acute phase.
Okay. And in the OBS unit, we've got a couple of rooms that are seclusion rooms, and I was hoping you could tell the JMOs some situations in which we might need a patient to be in a low stimulus environment, such as the seclusion room.
So there are a number of reasons where seclusion may be used. Seclusion's not our first option when we're looking to provide care for people. We go through a de-escalation process, a medication process, and then a seclusion process is at the end of that line of management. But people can be placed into seclusion for a number of reasons. Usually the chief one is safety, and that involves safety for the patient themselves, perhaps safety for other patients and for staff. And it's generally around symptoms that the patients are experiencing, which can be very distressing, around delusions, mood disturbances, agitation, and where it's deemed that their behaviour has become unsafe.
Okay, thank you. I'm wondering whether we could talk next about the process or the process that follows a request for a JMO to come and review a patient who is in seclusion. Could you take me through that?
So seclusion can be initiated in a couple of ways. Particularly after hours, for example, it can be initiated by the nurse in charge of the shift if it's deemed that safety is at risk. And as soon as possible after seclusion has commenced, a patient should be reviewed, certainly within an hour, but as soon as practical after seclusion has commenced. So a JMO may be asked to review a patient, particularly after hours, when seclusion has commenced. When seclusion commences, the maximum time that we utilise seclusion for is 4 hours. So as it gets closer to that time, a patient may then will need to be reassessed to see whether seclusion needs to continue. So part of the JMO's responsibility there will be to make sure that the patient is medically stable and to determine whether a further seclusion period is required.
Okay, so just to summarise, a medical officer might be asked to come up to Banksia to review patient seclusion, essentially, one, to ensure that the patient actually does require seclusion for treatment of their mental illness, number 2, to check whether they're medically stable, and number 3 is to treat an optimised treatment of distressing psychiatric symptoms.
Yes, that's correct.
Okay, wonderful. Once the JMO comes in, take me through what happens at the seclusion and review.
So during that time, the JMO will assess what's happening with the patient. We can look at whether the patient has had some medication prior to seclusion, which sometimes and quite often happens, and we do keep monitor seclusion, I beg your pardon, we do monitor sedation scores and physical observations. So the JMO would be expected to review the patient, make sure that they're clinically stable, and determine whether seclusion is to continue.
Okay. Of course, this all happens in conjunction with nursing staff who are very experienced.
That's right.
Yeah, so when the JMO comes here, they will first of all ask questions to nursing staff and really get a collateral history from nursing staff to to really, I guess, ascertain what's happened, why the patient's in seclusion, and I guess they'd also ask about their medical history, what medications they've taken, and once they have that information, they'll go in with nursing staff, if safe. Yes. And they will interview the patient, and at that point they will ask the patient how they're feeling, try and work out whether what psychiatric symptoms are present, and then they'll ask lots of questions regarding their physical status. So whether they have chest pain, whether they've got pain anywhere, whether they've got shortness of breath, and they'll also have physical obs available to them. Is that right?
That's correct.
Okay, great. So it's quite a very quick process, isn't it?
Yes. Yes.
Okay.
And usually the patients are fairly well known to the staff within the unit, so we should be able to give the JMOs a very good history in terms of what's brought the patient in, how they're presenting currently, any potential risks.
Okay, wonderful. Look, thanks for that, Maureen. The other reason that a JMO might be requested to come to Banksia is for reviewing a patient who might be medically unstable. Could you give some examples of, some examples of when they might see a patient?
Certainly, JMOs may be called to see a patient for very similar reasons that they would be to the other wards in the main general part of the hospital, and that is if if there were concerns about someone's well-being, their physical observations, for example, if they were in the clinical review range on the SAGO chart, if the patient had chest pain, and any other sort of medical reason that someone may need an assessment. If someone has a fall overnight and needs to have a medical review to make sure that they haven't sustained any serious injuries from that fall.
Okay, so really it's exactly what they would do on a medical surgical ward.
That's right.
Okay, great. Well, hopefully that's demystified some of the concerns or I guess misinformation that JMOs might have about Banksia. Thanks for your time.
No worries, my pleasure, and the staff are always there to help whenever they can.
Okay, great.
Thank you.
Thank you.